Governor Holcomb's briefing will begin in 2 minutes. For the journalists joining us in the digital press room, if you'd like to ask a question, you can click the Raise Your Hand button. When you are called upon, we will unmute your microphone, and then you also will have to unmute your microphone.
Good afternoon. Thank you for joining us. Hopefully, again, we've got some key updates for you across various areas. One very timely, one being the election front. June 2nd is just a couple weeks away from where we are right now. Of course, Dr. Box will give us an update on our leading indicators, how we're holding ourselves accountable as our roadmap, our Back on Track roadmap unfolds. We'll also hear from Fred Payne. Yesterday was Thursday, so we've got some up-to-date numbers out in terms of employment/unemployment, and then we'll also hear from Luke Basso from over at the IEDC, the Indiana Economic Development Corporation, on our PPE, our protection equipment, personal protection equipment inventory. So with that, we'll jump right into it. You've got some Regenstrief updates, you've got our daily report updates, you've got even some updates on our 4 guiding principles.
Yeah, thank you, Governor. Good afternoon, Hoosiers. Today we reported 614 additional cases of COVID-19 here across the state of Indiana, bringing to a total the number of Hoosiers infected with COVID-19 or SARS-CoV-2 to 26,655. We unfortunately saw an additional 42 deaths in the state, and to date we have had 1,550 Hoosiers who have died of COVID-19. Another 141 are believed to have died from this disease based on their clinical diagnosis. We've also seen the number of Hoosiers who have been tested for COVID-19 top 165,000 across the state. Our ICU bed and ventilator numbers are continuing to hold steady. Many of these numbers are sobering, but there are other numbers that give us hope, and as we move through these 4 guiding principles that the governor has said he will use to determine how we open the state. Our partners at Regenstrief continue to analyze data from the Indiana Health Information System and give us a clear picture of where our hospitals stand. We have their latest examination of data that sheds light on recovery and hospitalizations. So far, we've looked at 25,832 individual patients who were tested positive for COVID-19 since March the 1st. Of those individuals, 7,012, or 27%, visited an emergency department. 19% have been hospitalized. 1,100 patients have been admitted at some time during their hospital course to an ICU. That's 4% of all of our positive patients, or 23% of those who were hospitalized. An important part of that hospitalization data is also the discharge data, which helps to show some of our recovery rates. 72% of hospitalized patients have been discharged. 11% are likely still hospitalized, whereas 17% of hospitalized patients, unfortunately, have been known to die. This information in the Fairbanks study, along with all the other data that we collect each day, is helping us to be able to monitor the 4 guiding principles we use to make decisions about how safely we can reopen to this new normal here in Indiana. As you recall, these principles are the daily hospitalization rate, our ICU and ventilator capacity, our testing, both the ability to test and the positivity rate, and our contact tracing. Let me start with hospitalizations. This slide shows we are on the right path in terms of hospitalizations, dropping from 170 patients admitted in April 1st to 71 on May 12th. The number of COVID patients and people under investigation peaked about 30 days ago. As we've said, we do expect to see more cases as people start to get out more. So we will be monitoring this data closely as we look at more parts of the state to reopen. In addition to monitoring the number of hospitalized COVID-19 patients, we have also worked diligently to ensure that our healthcare system retains the capacity to treat this surge of patients. That's why we've been providing regular updates on ICU bed and ventilator capacity. When this pandemic first started, our concern was that we would not have enough beds or ventilators for people who need them, and many of the models that we saw from other states indicated that we would outstrip our capacity during the surge. We were able to flatten that curve and keep the surge manageable to date. We've done that by staying at home, by wearing our masks and washing our hands to help limit the spread of this disease. Our hospitals built capacity by converting rooms into ICU beds, and we acquired additional ventilators for that opportunity if we would need them during a surge. As a result, the ICU and ventilator rates are holding steady. That means we have the ability to care for our most severely ill COVID patients, and I hope that's reassuring to Hoosiers across the state. Another of our guiding principles is to have the ability to test all Hoosiers that have symptoms of COVID-19. We have made significant progress toward this goal despite continued challenges with getting testing supplies and have seen a large increase in the number of Hoosiers who have been tested. Since April 15th, more than 100,000 Hoosiers have been tested for COVID-19. By comparison, for the first 6 weeks, we tested just under 59,000 people between February the 29th and April the 14th. The drive-through clinics that we're holding every week around the state have been a big part of this effort. We have tested 8,100 individuals through these clinics and continue to work to offer 4 clinics around the state each week. We also have launched nearly an additional 50 sites around the state where Hoosiers can get tested. To date, more than 6,000 Hoosiers have been tested as of Thursday. We expect that number to increase significantly as we add the new location and adjust other locations. We have more than 170 locations now listed on our testing site map at www.coronavirus.in.gov. As you heard yesterday, we are preparing for a second wave of testing for the IU Fairbanks School of Public Health research study in early June. There we expect to test an additional 5,000 people. This study is an invaluable tool because it has already shown us that the majority of cases in Indiana were the result of close contact, oftentimes household contacts, and not a large amount of community spread. That 2.8% rate includes 1.7% of individuals that were positive for their PCR, so actively infected at the time, and another 1.1% that were positive for the antibody. It also showed us that 45% of those who were tested were asymptomatic or pre-symptomatic, which means not only the need to continue the social distancing, the wearing of masks, and washing our hands, and the very, very important aspect of contact tracing, which is our 4th guiding principle. To that end, we launched our new centralized contact tracing this past week. We started with 21 counties that represents 56% of our statewide cases. We have hired more than 500 contact tracers, which exceeds our goal of having 500 on board by the end of this month. That workforce has included doctors, nurses, epidemiologists, nursing students, medical students, and clinical social workers. Nearly 2,200 outbound calls have been made to date. We will add the remaining Indiana counties this upcoming Monday. I want to share some of the success stories from this first week of contact tracing. One person that we spoke with had no idea she'd been exposed, but because of the individual who was positive was able to provide good contact information, we were able to talk her through what exposure means and how to effectively quarantine and protect her family and her friends. We also reached a very emotional Hoosier whose spouse had just passed away. She had very diligently kept a diary of every time she had left home and the visitors that had come to her home. She thanked our agent and said she was very grateful to us for calling people to help contain and stop the spread of COVID-19. Another Hoosier had no idea he was positive when he had traveled. He was able to walk through where he had been, identify individuals with whom he had had close contact during that time so that we could help to protect them. Gratitude. One citizen said, the information that we were able to provide her with made her feel much better and much more prepared to care for herself and her family in order to protect them and others by preventing the spread of COVID-19. Our goal is to ensure that people are contacted within 24 hours of their test results so that we can protect their families, their friends, and all of their coworkers. I am incredibly grateful for all of the data that is informing us as we navigate through these 4 guiding principles. These are monumental efforts that will increase our understanding of the burden of COVID-19 and allow us to make the best possible decisions for Hoosiers in these uncertain times. Thank you.
Thank you, Dr. Buck. Speaking of launched, under the direction of Secretary Schellinger at the Indiana Economic Development Corporation, we launched last week the PPE marketplace. Luke, you want to give us an update on how that's going a week into it?
Yeah, thank you, Governor. Luke Basso, Chief of Staff, IEDC. First, I'd like to give you an update on the PPE procurement donations. To date, the state has secured commitments for more than 16 million pieces of PPE, up from 9 million reported last week, with more than 12 million items already delivered to the state of Indiana. 8 million pieces of PPE have been delivered in the last 10 days. Not only is our business community stepping up to manufacture and source PPE, of the 16 million pieces committed, over 1 million of those have been donated by Indiana businesses. Special thanks to all of our partners, including Cook Medical, Ivy Tech, Herta Autosports, and Fiat Chrysler, who this week alone donated 150,000 pieces of PPE. As announced last week, we launched the Indiana Small Business PPE Marketplace for restaurants, retail, personal service, and office environment. Initially, we were able to fill 10,000 orders through the marketplace. As of today, the initial 10,000 orders have been shipped. Just like any operation, though, there have been some hiccups along the way, and less than 1% of the orders did have minor shipping issues. However, we worked with our logistics partner, and we were able to get those bundles reshipped this week. In total, the marketplace has received more than 20,000 orders since it went live last Wednesday. Through our procurement partnerships, the IEDC has been able to source enough non-medical grade PPE to be able to ship 12,000 additional orders next week. With additional supplies coming in daily, we anticipate we'll be able to announce additional shipments. Once again, I'd like to remind you that all the items in the marketplace are subject to availability, and the marketplace is a secondary source for PPE. You should continue to try and source PPE from other places before coming to the marketplace. While we're happy to be able to supply PPE to help you open your business, our first commitment remains to our frontline workers who continue to fight this virus daily. Again, I would like to thank the Indiana Department of Health and Secretary Schellinger and my colleagues at the IEDC for making the marketplace possible. Thank you.
Thank you, Luke. Secretary Lawson, like I said, June 2nd, right around the corner. You've had you've had to turn and burn and put in some safety precautions like never before in our state's history, and I suspect that our absentee process is heightened and maybe hyperactive compared to some previous years.
Absolutely, it is. Well, thank you, Governor. Thank you for your continued support. We're 18 days away from the June 2nd primary election, and my office has been working nonstop to make sure that we're prepared for a safe and a smooth election day. It's good to see the COVID numbers are trending in the right direction, but it goes without saying that we all need to remain vigilant in the weeks to come. So my office has been working to supply all 92 counties with personal protective equipment, or PPE, so that poll workers and election staff are properly outfitted for election day and early voting. Using the Federal CARES Act appropriation, many of our PPE supplies have been contracted from Indiana suppliers, and this is what we have purchased so far. 5,000 gallons of hand sanitizer and 10,000 refillable dispenser bottles. Over 4,000 gallons of disinfectant cleaner for voting machine and electronic poll book tablets with 10,000 refillable spray bottles. 85,000 12 by 12 microfiber cloths for disinfecting voting machines and electronic poll book touch screens. Over 300,000 pairs of disposable gloves. 200,000 ear loop face masks, 25,000 face shields, and over 3,500 acrylic sneeze guards. We've been very deliberate and careful not to solicit vendors supplying critical care needs as not to interfere with those supply lines. And we received these materials at a state warehouse just a few days ago. Some supplies are being stored as surplus in the event of a recount. Let's hope not. And the rest are being distributed to counties as I speak. Of course, we couldn't have done this alone. The Indiana National Guard has been invaluable and took the lead on receiving and sorting and shipping the supplies to all 92 counties. Shipments started being delivered yesterday. I believe 28 counties received supplies yesterday. And by early next week, all counties will have received their supplies. But without the support of the governor and General Lyles and Colonel Hackett and Major Anderson and all the guardsmen assigned to distribution, we wouldn't have been able to stay on schedule with this project. So it's important to note that these supplies only will cover poll workers and election staff. It does not cover the general public. So for those of you planning to vote early, in person on primary election day, please just, follow the directions that you've heard all along. Wear a mask. If you've got gloves, they're clean. You can wear those to the polling place as well. We want to protect all of you. We all need to do our part to keep our community safe, and I urge you to join our poll workers in following the CDC guidelines for personal protection and social distance. One of the most effective ways to protect yourself and keep your poll workers safe is to vote absentee by mail. I encourage all voters to vote absentee in the June 2nd primary. The deadline to request an absentee mailed ballot is next Thursday, May the 21st. You can request one of those ballots by mail, fax, email, or submit an absentee ballot application online at www.indianavoters.com. It's a very simple process, and you don't need an excuse to request one. Once you receive your ballot, vote, put it in the inner envelope, and put that envelope in the postage prepaid envelope and sign it and send it back. Your county clerk needs to receive it by noon on Tuesday, June the 2nd. Again, that's not the postmark date. They need to have it in hand by noon on June the 2nd. We are anticipating and have had a higher number of absentee ballots than normal this primary. For reference, and I'm speaking of mailed ballots only, in 2016, 53,818 voters cast an absentee by mail ballot in the 2016 primary election. This year, as of this morning at about 7:45, my last report showed 330,657 voters have cast an absentee ballot by mail. And again, we're 18 days out. In fact, Marion County has seen 56,148 absentee ballots cast so far, more than the statewide mail total for 2016. Allen County, Hamilton County, Lake County, and St. Joseph County round out the top 5 counties for absentee numbers. Through the CARES Act, we have also tripled our usual voter outreach this cycle, and we have focused much of this outreach on how to request and return an absentee ballot. Voting absentee by mail is safe and secure, and it's important to remember this isn't a new process. It's just an expansion of something that clerks do every election cycle. And as we weather the COVID-19 storm, it's the smartest way to vote. And again, I encourage you to submit your absentee ballot application by Thursday, May 21st. Actually, I would encourage you to do it right now if you haven't done it yet, because the clerks will be very, very busy. If you decide to head to the polls in person, whether early or on Election Day, I think considering to vote early in person really and truly might be a smart thing to do. We are trying to spread out, any crowd, and so beginning on May the 26th, the Tuesday after the Memorial Weekend, you can vote early in person. Check with your county as regards to the locations because they may be different than in the past. But again, we will be open for in-person voting June 2nd, 6 a.m. to 6 p.m. We've also been in close contact with counties through this process to make sure that they have what they need. And this past week, we sent out a survey to counties regarding poll worker appointments. Many counties have their positions filled, but some counties still need help. If you are a registered voter in the state of Indiana, please consider contacting your county clerk's office and volunteering to work the polls on Election Day, June 2nd. You'll be paid for your time, and this pay does not count against unemployment thanks to an order signed by the governor last week. And remember, and one other thing is, Election Day is a state holiday for state and county workers. And so if you're a state employee and you would like to perform a civic duty, we would love to have you volunteer to be a poll worker on Election Day. And once again, thank you, Governor Holcomb, the Indiana National Guard, our hardworking county clerks, and those volunteering as poll workers, my staff, and everyone working to make this election run smoothly. Thank you.
Thank you, Secretary Lawson. And you're going to be able to stay and answer questions because I'm assuming yeah. Fred, you want to give us your weekly updates? With the Department of Workforce Development, I should have said.
Sir. So our initial claims for the week ending May 9th are at 30,691. This continues a weekly downward trend since our peak back in March. We paid out a total of $1.4 billion in unemployment insurance benefits since March. That includes $440 million in state benefits and $1 billion in federal benefits. We've had nearly 2 million call interactions since April, and over 350,000 interactions in May so far with our call center. Additional staffing and technology changes continue to help us to improve. Our average call wait time has been reduced by 50% between April 24th and May 11th. Our claims volume, of course, is extremely high. Technology, automated changes, and increased staff have also allowed us to move more claims to resolution. With solely increased automation and automated claims, we've been able to move from resolving 63,000 issues weekly to 270,000 issues weekly. With increased staff, this is the manual part of our process. We've been able to move from resolving 6,800 issues in a week to 27,000 in a week. This is a positive trend, but we know that this trend has to get deeper. So I want to discuss the top reason why claims go beyond 21 days. This is because a claim may have an issue or multiple issues. Well, what is an issue? An issue is anything that causes a claim to be reviewed. A single claim may have multiple issues. So a claimant and employer, there has to be some type of interplay between the two when we resolve an issue. So for example, we would have to talk to a claimant and an employer to resolve the issue. If we can't get in contact with one or the other, we leave a message and we have to wait 48 hours for them to return the call. If they return the call and leave a voicemail and we don't get back into contact with them, the 48-hour cycle begins again. That's the typical handling process when an issue occurs. There are 3 issues that have the highest volume for us right now. Those 3 issues are deductible income issues, employment status issues, which are full of part-time issues, and voluntary quit concerns. Each one of these issues requires a dedicated person to investigate them. We can't automate this. We have worked with our process and automated out as much as we can to ensure that we have quicker and faster claims processing on those issues. We're trending in the right direction here, but we know that it's not deep enough where every single Hoosier who has filed for unemployment benefits is feeling this positive trend. But we will get there, and each and every Hoosier who is eligible for unemployment benefits will receive those benefits. Now I want to give a quick update on some of our federal programs. As you may recall, we quickly added the $600 a week add-on for PUC, or the Pandemic Unemployment Compensation. We paid to date $998 million in PUC claims. Under our PUA claims, or program, the Pandemic Unemployment Assistance Program, on May 8th, the day we consistently shared that payments would begin, we started making PUA payments. To date, out of the 68,000 claims filed, we've paid 60,000 of those. We're working through all of the retroactive payments that we need to make on this group of workers. We've also started last week our PEUC program. That's the Pandemic Emergency Unemployment Compensation Program. This is essentially the 13-week extension for unemployment, because otherwise the program goes for 26 weeks. So that program is now in effect. Those are the three programs that we have now implemented, and we're continuing to revise each one of those programs. As you may understand, that when you put new programs up pretty quickly, there may be some kinks we need to continue to work out. I want to talk a little bit about job availability and the public information that I'd like to continue to share. As an agency, we continue to have the responsibility of connecting people to resources, connecting people to job training resources, connecting people to jobs, and connecting employers to skilled workers. Last week, we had a virtual job fair up in the Kokomo area for General Motors. We had a record number of registrants who participated in that program. So coming up on May 20th and 27th, we have a virtual job fair for the Terre Haute area. But we're also partnering with the U.S. Census Bureau to present a special statewide virtual job fair on Thursday, May 21st. There will be more than 700 positions looking to be filled across the state. For those who are looking for employment opportunities, feel free to visit indianacareerready.com. Now I want to finally talk a little bit about our rapid recovery plan. As I mentioned a few times before, we have a rapid recovery plan and team in place so we can continue to work on how we quickly ramp up and get out of this pandemic and skill people for the jobs to come. So we'll continue to plan and provide in our rapid recovery plan timely and relevant support to Hoosiers looking to advance their job skills. The plan will include resources to pay tuition and fees to enroll in certain college and job certification programs. We'll have more information on this to be rolled out pretty soon. As a reminder, this program, or this rapid recovery plan, is a joint effort with the Governor's Workforce Cabinet and the other not-for-profit organizations throughout the state. Thank you, Governor.
Thank you, Fred. Just a few quick items before we jump right to the Q&A portion of the program. We find ourselves in a season now where a lot of Hoosiers, be it parents or students, are taking their last day photographs. We've got a lot of high school students and a lot of college students graduating right now and in the weeks ahead. And I just wanted to recognize we understand how much they've endured. They have been maybe knocked back, but certainly not knocked down. They got creative pretty quickly. It's been heartening to see some of the creative photos out on social media of folks in maybe an empty gymnasium, cap and gown, or maybe out on the farm, unlike some other past years, or parades that are going in front of a house celebrating a student's success, or principals or teachers delivering gifts to a front doorstep and, knocking on the door and then backing up and giving the old salute. And I just wanted to say from myself and from all of us to all of those graduates how proud we are of them for enduring and overcoming all of these challenges that you've taken on one by one, proving you're flexible, proving you're resilient, proving that you'll persevere. These are the very traits that are really going to serve you well in this next chapter ahead. So I didn't want this week to get away understanding what was occurring over this weekend and starting to see more and more pictures of those success stories. And I cannot wait to see where you all end up, knowing that you have gone through this challenge. And if there is a silver lining to some of this, it's, as I've said before, when you confront great challenges and come out on the other side, there's a lot of opportunities out there, and it's being recognized by a lot of folks. So congratulations, graduates. Also, wanted to give you two very quick websites, very timely websites. We've always been a leader in years past in terms of our census and filling out the form. That's very important. A lot of us haven't done that yet. I'm not speaking for myself. We're good, but a lot of Hoosiers haven't done that. They're voting absentee. Good. You said smart, but the other smart thing to do is to go to my2020census.gov, my2020census.gov, and fill out that form. That's going to, in part, determine not just how many represent our Hoosier interests and where, and funding, and how that is allocated in those areas of need all across the state of Indiana. So we've got a shot to do this, and we need to. So please go to my2020census.gov. And then lastly, another website, www.coronavirus.in.gov. There you can go find where there are good Wi-Fi hotspots. And so if you don't have a strong signal at home, or you don't have service at home, we can show you at that website the closest available Wi-Fi hotspot. Now, keep in mind, we're going to do everything. We've allocated $100 million to bridge this digital divide throughout the state of Indiana and most of our rural parts of our state. That program is continuing. It's been underscored or accented even more, the necessity to complete that program in the times that we're living in, and in this new, as you said, new normal or new reality ahead, where telemedicine and telecommuting and teleeducation are going to continue to just increase in demand. And so again, www.coronavirus.in.gov, and you can figure out exactly what's closest to you. And with that, Rachel, let's start with the first question.
Victoria Ratliff, the State House file.
Good afternoon, Victoria.
Good afternoon, Governor. So the COVID-19 Health Disparities Task Force was created to study the issues of how African Americans and other minorities are disproportionately affected by COVID-19. So who all is on the committee? Will there be hearings that are available to the public? And do you expect there to be specific recommendations for actions the state can take now and in the future?
So those are great questions. Honestly, I'm not aware of absolutely everybody's on there. I know we do have representation from our legislative group. We have representation from our Minority Health Coalition, from our Black Caucus. We have representation from Health, from FSSA, so multiple different agencies. And individuals all across our state are becoming a part of this group. As we look at those disparities, we're not unknown to this. I mean, we look at disparities quite frequently and work with our Minority Health Coalition partners on a regular basis to address those disparities. But it's particularly evident when you look at something like a pandemic with COVID-19 and the importance of how we make sure that we not only do everything from our testing being targeted to those more disparate populations and making sure that that testing is accessible easily for those individuals, but connecting them to healthcare and to making sure that we're messaging that and communicating that in a way that really resounds with these specific populations. So we're looking at not only the African American and the Latino, but we're looking at the Burmese population, all of these populations. And so we appreciate those partnerships. And whether those meetings are open to the public, I'm not really sure, but I can find the answer out for you.
You want to just mention or give a reminder about the Fairbanks study and how this fits in there as well, and how we encouraged more to make sure that we had an accurate picture in terms of not inequity, but disparity as well.
Right. So even our targeted testing that we've done around the state with our drive-throughs, we've tried to make sure that we've put them in areas where actually 43% of our tests have been done on our minority populations through those drive-throughs. But when we looked at the Fairbanks study, we were very, very careful to make sure that we oversampled different populations so that we would make sure that we had a good representation of those populations so that we would really know. And as you remember from the numbers, we saw much higher incidence in our Latino population and our African American population. We've seen that bear out with hospitalized patients and also, unfortunately, with our deaths in the African American population.
And I'm looking at Dr. Sullivan, but we can include this in a conversation on Monday as well.
Kathy with the Ferdinand News.
Good afternoon, Kathy.
Had to unmute myself and the sign went in front. Good afternoon.
It is.
I had actually a question for Secretary Lawson, but first I want to give a shout out to Commissioner Payne because people in his office, and I wish I had her name on my desk, I'm trying to remember, went the extra mile to figure out a problem. I was being charged for someone else's unemployment that didn't live here because I'm the publisher as well. So I just wanted to say I got a call back at 6 o'clock at night and his staff really worked to solve that. So I wanted to give him a shout out.
Thank you.
But Secretary Lawson, my question for you, with that large a volume of write-in, mailed ballots, do you anticipate any kind of timing challenge for having the results? Do you think you'll have the results about the same time, or do you think it's going to maybe take a little longer?
That's a good question, Kathy. I think I may have mentioned at one other press conference, but absolutely, we are not expecting to have the results at 7 or 8 o'clock on election night. It's going to be nearly impossible. The counties are recruiting as many central count teams as they can, and again, that's a crucial part of the election process. So if you don't have the entire day to work on election day, you might think about working the entire night processing absentee ballots. If not longer. I think it's going to take 2 or 3 days, honestly, before we get the final results. Some of the counties, like Ohio County, the last time I looked, they had 71. So obviously they're going to be done. Marion County will not be done. It's going to take a while.
Well, that just made news. Okay.
Sandra.
That's great.
Sandra Chapman, WTHR.
Hello, Sandra. Good afternoon.
Good afternoon, Governor. I have a couple of questions. The first one is for Commissioner Payne. We are hearing every day from Hoosiers across the state about not being able to get their benefits, and many of these folks are made their filings back in March, right after the system opened up, and many of these folks were laid off. My question is there any priority that's going to be given to these folks who are now reaching very dire straits, lack of groceries, food, gas, whatever, you name it, there's a problem there. My second question is for Dr. Box, and this has to do with the CDC guidance on reagents and what should be used for testing. Wanted to know if these very specific reagents are impacting Indiana's ability to meet and deal with the expanded testing, and if there's a shortage at this time.
Okay. So I think that's a very fair question. One of the reasons why I share today the 3 top reasons or issues that we have in relation to the deductible income, employment issues, and other things like that is to share what top issues that we're working with. Those are the issues that have taken us the longest to resolve because of the interplay with an employer. And right now, we are prioritizing the claims that were filed the earliest. So we are working our way back from the oldest claims to address those issues.
Elizabeth Binion.
Can we hit
One more question.
Dr. Boxford, Sandra had a second follow-up about reagents.
Sandra, that's a great question, and as you probably are aware, if you have listened, that has certainly been an issue with us. That chokehold of supply of reagents to be able to run some of these tests has certainly been a problem. And we in the state of Indiana recognize that, and so we're working to make sure that we diversify our labs with regards to what machines are used so that we have different reagents with different types of machines to make sure that we have an overabundance of testing in the future, and actually working to see as a state if we cannot bulk buy that so that we will have protection in being able to have a better supply chain of those reagents.
More to come.
Elizabeth Binion, WNIT Public Television.
Good afternoon, Elizabeth.
Good afternoon, Governor. I have two questions. The first is for Secretary Lawson. How and when will the state decide if no excuse absentee by mail voting will be extended to the November general election? And my second question is this. Many people watching these media briefings are posting comments asking what the state is doing to help essential workers. They assert that they could earn more on unemployment than they are earning doing these essential jobs, and wonder how the state can help. So I wonder what your response is to that question, and also how the state will decide if and when no excuse absentee by mail voting will be extended to November.
Thank you, Elizabeth. We won't make that decision for a while. Obviously, it took a lot of compromise between both state parties. It took a lot of discussion with the Indiana Election Division and the Indiana Secretary of State's office to reach where we are today. And obviously, it's not going to be impossible to do that. We have done it now. And if we need to do it in November, we can do it. So, but that decision won't be made until this primary election is over and we see how things have gone. And the advice from CDC and our health commissioner and others when we get closer to the November election.
So in terms of the unemployment, and particularly the question around whether or not a person is earning a little bit more on the unemployment than they would at their normal jobs, there are a couple of things that play there. First, we have to keep in mind the very reason and the essence of why our unemployment system exists. It exists as a bridge between individuals who are out of work due to no reason of their own until they find a job. It's not to be a placeholder. So with that said, we are trying to ensure that there is an interplay between employee and employer on returning to work, and we're trying to make sure that we have, well, actually with the original executive order, the governor gave us broad flexibility ensuring that as many people who were impacted by COVID-19 were covered as possible. That's still in play, but an individual has to understand and make a decision on if they're going to return to work based upon the reasons why they're asked to return to work, meaning that their job is now back open and back running, and try to ensure that we're using our unemployment compensation system for the reasons that it was intended.
Adam Wren, Indianapolis Monthly.
Good afternoon, Adam.
Good afternoon, Governor. Just a two-part question. The first for Secretary Lawson and the second for Dr. Box. The first part of the question is, what is Indiana's plan for people, for voters who are blind and don't read Braille, or folks who have Parkinson, whose signatures rarely match those on file? It's my understanding that Indiana isn't going to comply with the American Council of the Blind's recommendations for voting. And then the second part of the question is, Dr. Box, what guidance do you have for people who are going to take part in the great Midwestern tradition of garage sales this weekend and in future weekends? Is that a safe activity for neighborhoods, particularly large neighborhoods, to have?
Well, mine may be the easier question to answer. Yeah. Yes, Adam, thank you. I understand that we do allow the blind to vote. Every voting center, every precinct has to have a machine that someone who is blind can use if that's what they want. They also, voters can also be visited at home by a travel board if they cannot make it to the polls. So, and we've done a great deal of work on our website, and we have a AAA rating when it comes to allowing people with disabilities, whether it's blindness, deafness, using that website. So we just worked really hard the last year and a half upgrading that website. If you have further questions offline, I'm happy to answer you, but I certainly believe that we're complying with that.
And Adam, that's certainly a question I hadn't considered yet, but I think it's a good question. I think that all of our prior recommendations and our encouragements still apply. And that is, I don't think if you're in a risk category, like someone who's over 60 or 65 or has underlying health conditions or is immunocompromised, that you should be having a garage sale. But secondly, if you do go to garage sales or if you have one, please wear a mask. Please have lots of hand sanitizer out and available for people. Please wash your hands frequently and make sure that people social distance. I don't go to a lot of garage sales, but I've seen some pretty busy areas before when people do go to garage sales. So again, people need to park separated and they need to stand separated, and you would be in charge of enforcing that in your neighborhood or at your own home.
I used to grow up going to some garage sales, and they got pretty competitive in the neighborhoods. But we might have to, Adam, we might have to include that in our Back on Track playbook.
Steve with KPC Media.
Steve, good afternoon.
Good afternoon to you. Two questions here. The first one for Dr. Box, real quick. There's been some questions about the accuracy of Abbott machines lately, and if it's my recollection, those were the drive-through machines that were using problems with accuracy. I guess, how are those being used in Indiana, and are there any concerns? And then for Secretary Lawson, while it's probably too late to change gears now on the election, with you encouraging voters to vote absentee today and saying that, quote, it's the smartest way to vote, I guess my question is then, why has Indiana chosen to assume the added PPE costs, the manpower complications with finding poll workers, and run health risks to workers and voters, both to have in-person voting at all this spring?
So it's an excellent question. I kind of expected you to ask about that today. It is disturbing to see the reports out that the Abbott ID machine, if you are known to be positive, maybe by PCR, the nasopharyngeal swab, you actually on the Abbott machine 30 to 40% of the time may test negative. That's very concerning for individuals that may be symptomatic at that time and shedding quite a bit of virus. And so my concept with that, and my team has discussed this, is those areas that are using this machine, we would strongly encourage that if you test someone and they're positive, you've got your diagnosis, right? So you don't have to do any further testing. If, however, they're negative and you're suspicious for that, or their contact makes them such that you'd be very suspicious that they could be positive, I would make sure that they get that nasopharyngeal swab for the PCR. The place that I know that we're using this the most is in some of our congregate living areas. I would say not in our long-term care facilities, but in our prisons, and we've already been able to talk with Dr. Doss and her team about that, and they already are making sure that they do PCR nasopharyngeal swabs on their patients. So that is there and available. Our drive-through sites never use the Abbott ID machines, and we'll be making sure that any areas that have this, that we educate and discuss with them what we think would be a great way to use them.
Yeah, so Steve, I think your question was why any in-person voting at all? Since we did make it easier for someone to request an absentee ballot, and we've had so many absentee ballots. And the answer is there are many people in the state of Indiana who voting on Election Day is a sacred right to them. They want to vote in person in the election, and we did not want to take that away from them. And as a matter of fact, the state parties, the Indiana Election Commission, and others felt that it was important. And we normally have in-person early voting for 28 days in this state, and we've cut it down to 7. So, and we're likely to have fewer locations for in-person voting. So we just felt like it was very important to allow those people their constitutional right to vote on Election Day.
Lauren Chapman, Indiana Public Broadcasting.
Hello, Lauren. Good afternoon.
Good afternoon, Governor. How's it going?
Very good. Yourself?
Not bad. My questions are actually for Commissioner Payne. What percentage of employment insurance claims have actually been resolved? We've heard from some folks who are estimating only around 20% have actually had their claims resolved. And to that point, can DWD supply a breakdown of how many people have claims outstanding by the number of weeks that they've been waiting? So for example, X number have been waiting 7, Y number have been waiting 6, et cetera, et cetera.
Sure. Well, first off, good question, and numbers are always important. We have resolved much more than 20-something% of the claims. As I mentioned earlier, we look at claims in terms of issues resolved, as that is how our internal reporting system looks. A claim may have multiple issues, maybe 3 or 4 issues, or maybe 1. So we resolve those issues on a weekly basis. The average number of issues that we're resolving per week is around the 220-some thousand issues per week. And in terms of the number of claims that we have yet to resolve, we do have those based on weeks, based on the time that they were submitted. So that is information that we have internally, and that's information that we use to work off of weekly.
Thank you, Fred.
Rob Burgess, the Wabash Plain Dealer.
Good afternoon, Rob.
Good afternoon, Governor. Good to be with you again. Quick question for you, and then one for Dr. Box and also you. Governor, we just heard Secretary Lawson's take on not moving completely to vote by mail. But on your end, why not do as California just did and declare ourselves a vote by mail state and send every registered Indiana voter a mail-in ballot? And then Dr. Box, I wanted to return to the IU Fairbanks study. I'm not a doctor or anything, but 2.8% seems like such a small percentage of the state to me. I would have guessed several times that number. Were you surprised to see that level of exposure at the point in time the study was done? And if that's what happened was the single-digit number of infections, what's the state going to look like when it reaches double digits? And Governor, do these numbers change your calculus at all in terms of opening up the state?
I think those are all excellent questions. And what I would say is Dr. Dan, who comes quite frequently, just off the cuff said 3%. I mean, he just basically said 3%. And so he was very proud of himself when it came back 2.8% overall. I will say that what it really showed us and what the statistics showed us is that if you lived with someone that was positive, you were 12 times more likely to get it. So it really did show us that there was a significant amount of transmission in that close contact, if you were especially living with that individual, but not near as much of that community spread that we thought could have been occurring. I think that it was quick and overwhelming with the number of cases that we had, but that was reassuring to me to know that as these numbers creep up, if we keep up on that, and we will keep up on that, when people come back positive and if the public works with us and gives us the contacts, we can control this by narrowing this down person by person through isolation of those who are positive and quarantine of those who have been a close contact. So no, I guess I wasn't surprised overall. I would have loved it if it had come back really high, because it would have given me some, reassurance that maybe we don't have some difficult times still facing us, but that's what we're watching for carefully.
And I would just say, Rob, your third question, the numbers will change my calculus. I mean, if the numbers change, our calculus will change in terms of our 4 principles. But as long as we are keeping those 4 principles as our North Star, as long as we're able to care for those who are in need, medically speaking, then we're going to stay on this course. If those numbers become threatened or take a turn south, then we'll course correct.
I did tell Dean Halverson and Nir Menachemi that I was very excited to see what the antibody data will come back from our early June study when we look at that phase of the study, hoping to see those numbers go up quite a bit.
Very interesting that it was 1.1%, 1.7%.
So 2.8 overall.
That's right. Not dodging or ducking or diving away from your question, Rob, but I'm going to let Connie, you want to mention something about his second question, and then I'll answer that as well.
Sure. Regarding why we didn't change our voting process for the primaries to be a vote by mail state. And the answer is, we worked really hard with our current laws to make sure that people could vote their preference, whether they wanted to vote by mail or whether they wanted to vote in person. If we became an all-mail state, that would be an issue that the General Assembly would have to take up. The Indiana Election Commission was allowed to work with the current state law. They're not allowed to change state law. They can work within the state law and make it easier for voters to vote and deal with an emergency, but they could not make that type of decision. It would be something the General Assembly would have to do.
And well, we have the means to keep this safe to vote. So, Rob, I would just say that while it's the smartest thing to do to vote from afar, I plan to vote in person. I'll just say that. I may vote early to spread it out, to slow the curve, but as long as we have the means to safely vote in person, I'm one of those people that subscribes to that I'm going to vote in person. But thankfully, we have a lot of options to vote safely.
Sam Quinn, the Indianapolis Business Journal.
Hello, Sam. Good afternoon.
Sam, you have to unmute your microphone.
Sorry, my computer was frozen. My question today relates to work share programs as an alternate to traditional unemployment. The Indiana Chamber today released a press release asking the state to reconsider their position on work share. Is that something you're considering?
We very well might down the road. We did take a look at this, Sam, and based on the need to upgrade our system and also the need to get some legislative support. It's not something that we're going to move forward on right now, but down the road it very well might be something we take a look at.
Our final question is from Dan Klein with Wish TV.
Good afternoon, Dan.
Good afternoon, Governor. I have two questions for you, somewhat different topics. First relates to the Attorney General's office issuing a letter to Marion County saying the restrictions on sizes of church gatherings are unconstitutional. What's your reaction to the Attorney General's opinion? Do you believe Mayor Hogsett and Dr. Virginia Kane have the authority to limit the number of people at church services? And then my second topic, last week I talked to the owner of Shapiro's Deli, of course, an icon in Indianapolis. At the time, he said we might have 30 days left before he closes for good. We've seen a lot of other places close. And in particular with the stat that positive cases are 12 times more likely in the household, some would say it's time to reopen more quickly for most of the population, those that are not at risk. What would your response be to them? What would you tell businesses who don't feel like they have any other choice but to close for good?
Well, I look forward to going to Shapiro's myself. I'm a longtime customer, but we have to do this safely. And I understand the 30 days away, and I get it, and it pains me to have to execute this plan gradually and methodically and safely and responsibly. We're trying to get there as safely as fast as we can, and that's the qualifier. And so I look forward to seeing him in person at the earliest available time. Your first question was regarding the Attorney General and Marion County. This is precisely why, at the very outset, we said that we would be supportive across the board of localities, local governments, kind of home rule, if you will, if they wanted to be more stringent than our back on track playbook or roadmap. And this is a case where the mayor here in Marion County has done just that. In terms of the legal ramifications, that's for the court to decide.
Thank you for joining today's briefing. Governor Holcomb's next briefing will be Monday at 2:30 p.m. Eastern.